This video is meant to highlight for you some of the recommended complementary therapies for treating Meniere's disease. But first, a little background on the disease itself. Meniere's disease is considered rare and is indicated by fluid buildup that's present in the inner ear. It's also called idiopathic endolymphatic hydrops. Idiopathic indicates there's no known specific cause. On the website hearinghealthfoundation.org about Meniere's disease, the three conditions found to indicate Meniere's disease are vertigo, tinnitus, and hearing loss. Vertigo is commonly diagnosed for many people, again with no obvious cause. Johns Hopkins at hopkinsmedicine.org tells us the symptoms include dizziness, loss of balance, difficulty hearing lower tones, headache, sweating, nausea, and vomiting. It can also be accompanied by tinnitus or tinnitus, depending on who you talk to, which is a ringing or constant swooshing in the ears. However, tinnitus very often exists by itself for many people. The medication meclizine is available over the counter and is recommended for people experiencing this dizziness or seasickness. At mayoclinic.org, you will find these symptoms described that indicate Meniere's disease. 2 or more vertigo attacks, each lasting 20 minutes to 12 hours, sometimes up to 24 hours. Hearing loss proven by a hearing test. Tinnitus, or a feeling of fullness or pressure in the ear. In most cases, the disease presents in one ear only, but can spread to both ears, and most patients are in the age range of 40 to 50 years old. Screenings for Meniere's disease include the hearing test called an audiometry. It tests for distinguishing different pitches and volumes and how well you can tell the difference between words that sound the same. The balance test is an EMG electromyography. An MRI or magnetic resonance scan can detect if there's any mass present in the inner ear. An electrocochleography, ECOG, measures how the inner ear reacts to sounds and detects electrical activity in the inner ear to see if there is a fluid buildup. The video head impulse test, VHIT, looks at how well the eyes and inner ears work together by measuring eye reactions to sudden movement. If your eyes can focus on a point when your head is turned quickly, that's normal. If your eyes move off the target when your head is turned, you have a reflex issue. Medical treatments are described at the National Institute on Deafness and Other Communication Disorders, found at nidcd.nih.gov/health/Meniere's disease. They include medications meclizine, diazepam, lorazepam, and glycopyrrolate. There's a newer device called the Meniere pressure pulse treatment worn inside the outer ear that gives off little blasts of air pressure to the middle ear to disperse the fluid. Also, gentamicin antibiotic can be injected into the eardrum and has produced good results so far. These are also mentioned in greater detail on the website dizziness-and-balance.com/disorders/Meniere's.html. Surgical puncture and placement of a stent or shunt on the endolymphatic sac to decompress it has also brought relief. And finally, labyrinthectomy is the removal of a section of the intricate labyrinth. Now to the complementary therapies used by professionals to alleviate or lessen the symptoms. These reports on results of holistic therapies for MD patients are not plentiful. There are a few well worth noting, however. The Mind and Body Holistic Health Clinic in the UK, mindbodyheal.co.uk/Meniere's disease, does not suggest any complementary therapies that we're familiar with today, such as acupuncture, meditation, relaxation, or yoga. Instead, they list multiple supplements to add to the diet. Here are some examples: manganese 50 milligrams per day, chromium picolinate daily, magnesium 200 milligrams per day, calcium, and vitamin B12. For improving circulation, the website suggests niacin with vitamin B3, cayenne pepper, ginkgo biloba, and coenzyme Q10. Also, alpha-lipoic acid for hearing loss and vitamin C with bioflavonoids for keeping plaque from forming in the arteries. Dr. Axe, founder of Ancient Nutrition, states on his website, draxe.com/health/Meniere's disease, that reducing stress can lessen the severity of the symptoms. Also, he mentions sounds like waterfalls, rain, wind, and music therapy that improves blood flow to the inner ear, contributing to relaxation. Deep tissue massage, Reiki, or lymphatic drainage massage can reduce fluids the body is retaining. He cites the Journal of Alternative and Complementary Medicine's findings that acupuncture helped to relieve the vertigo symptoms of a patient with Meniere's disease. He also suggests dandelion tea as a natural diuretic. Upper Cervical Chiropractic of Monmouth, New Jersey cited one study found on getwellnj.com/5-natural remedies Meniere's disease that stated in 300 patients, 97% saw a 90% decrease in Meniere's disease symptoms after receiving upper cervical chiropractic care. Thank you for listening to this presentation brought to you by a student of Miss Jenny Delgado, Mary Beth Deaton. Have a wonderful day.